Hello, PsychU community, and welcome to today's webinar, Transforming Mental Health Care in the U.S., a discussion on the RAND Corporation Report. Thanks for joining us. My name is Dr. Tara McKinley, and I'm a Managed Market Liaison for Otsuka Pharmaceutical Development and Commercialization, and I'll serve as your moderator for today's discussion featuring Dr. Dawn Fells. This program is paid for by Otsuka Pharmaceutical Development and Commercialization and Lundbeck LLC. The speakers are paid consultants for Otsuka, and I am an employee of Otsuka. All right, so today we're going to be talking about the RAND Corporation report. And this was a report that was conducted in collaboration with Otsuka, and it was a research team from the RAND group that sought to identify goals and strategic initiatives that would help to transform the US healthcare system. And so the report really tried to pinpoint the opportunities in strategic, specific manner that could break out the healthcare system and focus on key initiatives that would help to drive change in the US, specifically looking at the mental health aspects. Dawn, after your first take on this report, what were your initial thoughts?
Well, first off, it's a great report. It's really worth reading. In addition to interviewing well over 1,000 health plans around the country, there's a lot of good information on federal, state, and employer-related initiatives as they've occurred over the past few years. And I think one of the things that I really took home were some of the major trends in our country right now that probably many are aware of. But one of them is just the increasing awareness of behavioral health and its importance in our health system. I think historically it's been sort of siloed off on the side. But I think as people have dealt with it with opioids and COVID, as well as seeing it in the data, the importance of behavioral health is becoming increasingly so. And I think the other thing that was really noteworthy is just how much is moving and changing. The world is not sitting still at all. And so there are a lot of new models that have been developed. There's a lot of really good technology. COVID has been in the thick of this. And then the last thing that was really noteworthy among several things, though, frankly, but keeping it to three, was the role of the ultimate payer, meaning government or the employer. So employers still pay for about half of the health insurance in this country. In other words, 50% of the nation is employed by employers, and then roughly 20% by Medicaid, 20% by Medicare. Those are the really big ones, but it's interesting too that Medicaid is increasing with the uninsured coming on to Medicaid, and then also COVID having an impact there. And so I think the role of government is increasingly important, particularly so for behavioral health, where Medicaid is the #1 payer for behavioral health services. But employers too still have a significant impact on what goes on.
Yeah, they definitely do. And I know you just recently did a talk on that on PsychU as well. So, diving deeper into that, I think is incredibly important for the healthcare system as well. So in the report, it talks about three main goals, and then there's some goals that are broken down within those goals. So the three main goals were promoting pathways to care, improving access to care, and establishing an evidence-based continuum of care. So in the first goal, the promoting pathways to care, one of the key elements was promoting mental health education. So how can we as a nation come with mental health education? How far have we come with that? Where do we have to go? And what are some initiatives that those throughout the nation and the communities, what can they do to promote pathways for additional education here?
Yeah, I mean, we have come a long way. There's a ways to go for sure, but where it was 20, 30 years ago, we've come a long way. And some of that's due to technology, with online information being so readily available. Now, an awful lot of it's good, some of it can be not so good, and it's a little, so you wonder sometimes if you're not in the industry. But there are some really great resources for providers. For example, the one I'm most familiar with is Relias, which does a lot of online learning for providers in behavioral health. And there are things like a behavioral health 101 for primary care docs that was developed that in response to a need there. On the member side, there are also some great resources. I think part of the challenge is deciphering through all the information that's there and getting to the stuff that really is quality and good and relevant to one. So, one thing I know, this is kind of funny, I've seen it so often, but I know, like when I was in med school, for example, when I first, little new student there, you start reading these textbooks, you think you have every illness in the textbooks. So there's really a lack of perspective. I think that's a little bit the challenge here, but I think there are technologies that help people really get to the information that they need and use it in the ways that they need to. So I think that there's some great initiatives. There's another modality is one that was developed in Cincinnati by one of the psychiatric facilities there in the University of Cincinnati, along with some employers, where they started basically a group called Start the Conversation, and it was in response to a company having suicides at the C-suite level and not knowing what to do. So they got all the employers together in Cincinnati and started having this literally conversation about mental health issues, and it really did raise awareness. It really, because mental health issues, it used to be that person in the other neighborhood or down. Now it's all of us. We all are touched by this.